Hi everyone, it's Laura. I wanted to share with all of you the supplements that I take every day while breastfeeding twins and just providing ways to help your system not run out of some of the essential nutrients and just something that I found has worked for me with my routine. All of this is based on evidence from the CDC, and I do happen to be a pharmacist as well. So I'll also include some of the brands that I use, reliable manufacturers. So here we go. First one I have is a prenatal. Anybody who's breastfeeding, it's a good idea to take one of these. Next up is omega-3s. It does pass into the breast milk and it does help with brain development. Little buddy, it's okay. I do take a little extra calcium and D. There are certain things that are provided in the prenatal, but because you're breastfeeding too, I take a little bit of extra calcium and D just so that my bones don't start losing all their calcium stores. Next one is choline. Something that I've heard some pediatricians talking about. They think that this should start being added to the prenatal vitamins. They haven't yet, is because it's so recommended, is choline. I did start taking this while I was pregnant, and this one does also pass into the breast milk. It does help prevent autism, or helps reduce the risk of developing it. So something to keep in mind. Next one is I take slow magnesium. Breastfeeding, I lose quite a bit of electrolytes as well. So I found that I get really restless legs at night. So on top of the slow magnesium, just because that's a little easier on my gut, is the slow magnesium. It's a delayed release. Because magnesium, I'm not sure if many of you know this, can cause loose stools or diarrhea. So slow magnesium helps with that. Another thing that I do for electrolytes or restless legs, by the way, having balanced electrolytes can help prevent restless legs. So just something to know. I put 2 packets of Pedialyte into a bottle of water about that size. I drink it every night. That has really helped with my restless legs. I did that towards the end of my pregnancy as well. So I found that very helpful. While on the subject of hydration, I just bring an extra water bottle. It's because breastfeeding twins takes a lot of liquid out of you. So it's important not to get dehydrated, as I'm sure you all know. So one thing that did happen with me after I gave birth was I lost some hair. Oh no, it goes all the way back there. So to kind of help with that, my hair regrowth journey, I take some biotin, and that kind of helps strong nails, skin, hair. And then next thing that I take is some zinc. That's something newer off the CDC website for all breastfeeding mothers that I started taking, and then iodine as well. So that's it. That's all that I take every night. So just thought I would share a video for the purpose of some of those things. And one thing that I did do the first 2 weeks after my C-section, and you can do this with either kind of birth just because you lose so much blood, is I took a slow iron as well at night. If your stomach can handle it, I would highly recommend it. So just something to keep in mind. That kind of helps with your blood regeneration as well. Iron is best absorbed, just so you all know, so in an acidic environment. So that means on an empty stomach, or if you have just taken something acidic. So your prenatal also has, oh dear, oh no. Your prenatal also has iron in it. So if you're taking iron and a prenatal, it can be hard on your stomach. So you can take that with food. But if you do take it with food, I would highly recommend taking it with some 500 milligrams of vitamin C. And that'll just help your body absorb it. The vitamin C makes your stomach more acidic, and that'll help your body absorb it. If you can't tolerate it on an empty stomach, that also counts as being acidic, and that can help your body absorb the iron to a greater potential. So just all things to consider. You all are doing so wonderful, and you take care, everybody. Thank you.